Hi, I am Dr. Shilpy Dolas. I am consultant breast oncosurgeon and oncoplastic surgeon in Aditya Birla Memorial Hospital in Pune. We are talking about the breast cancer today. As we know, all of us, that breast cancer is increasing day by day, incidence is increasing. It surpasses the cervical cancer incidence also because of certain factors. Mostly breast cancer is not genetic, but we cannot neglect the tendency of genetic tendency of the breast cancer in females, which is present in 5 to 10% of individuals. Rest of the breast cancer, 80% of breast cancers are sporadic, which are related to our environmental factors, how we grow, how we eat, how we live. So according to that, the breast cancer chances will increase day by day. So it's not one day process, it is a process of 10 to 15 years which affect our bodies. So now what a lady should do when they want to know whether they are suffered from breast cancer or any kind of breast problem or not. There are certain signs and symptoms of breast cancer and breast lump. The first and foremost sign is breast lump. So anyone who has got a breast lump, first sign, either it is painless or painful, they should go to the hospital and report a doctor. Doctor will detect whether that lump is cancerous or not with the help of certain investigations like mammography, sonography, that is ultrasound of the breast, as well as biopsy. Without biopsy, it is difficult to tell whether a lump is cancerous or not. But some of the lumps are not cancerous. They are just nodularities. They are not exactly the lumps. So do not get panic. Go to our hospital, come to us. We'll detect whether your lump is cancerous or not. The second most sign is nipple discharge. Any kind of nipple discharge, bloody, yellowish, greenish nipple discharge, you should tell your doctor that how much is a nipple discharge, how much is the quantity, when it is coming, since when you have noticed this nipple discharge, whether a month, whether 15 days or a year. These kind of things should not get neglected and be told by the patients to us. The third common thing is change in the shape of the breast. Sometimes the breast cancer won't come directly as a lump. Patients will notice the breast uneven size of the breast and the change in the skin of the breast. That also indicates some kind of breast cancer which are higher in stage or inflammatory breast cancer. In that case also treatment is possible. Do not neglect it. Fourth is, other than the breast, when something is present in the armpit, any kind of lump which is mobile or fixed in the armpit needs to be addressed by a breast surgeon. So please do come. We have higher investigations, a digital mammogram. With the help of that, we can detect the precancerous lesions. There is a stage 0 in breast cancer also, which is called DCIS, ductal carcinoma in situ, which is a precancerous stage. So with the help of mammography, we'll detect those DCIS cases and address those cases. One thing is important, that treatment of cancer is not only possible with medicines. So do not even try only and only medications for the breast cancer. It is mandatory to visit a breast consultant, breast oncosurgeon, and take the full guidelines of the treatment of breast cancer. The other thing is, along with mammography, we'll do the matching ultrasound with the high-end techniques, the 3D ultrasound techniques, and with the help of that, we'll do the biopsies, USG guided, ultrasound guided biopsies, and see and monitor the lumps. So all these things are called triple assessment. Assessment by a consultant, assessment by a radiologist, and assessment by a pathologist who will detect on biopsy whether the lump is cancerous or not. We'll sure give you the final treatment and hope that no one will be affected with breast cancer in next 20 years. Thank you.